909. All 909.
Let me welcome all to this small official ceremony at the Glendon Hospital. We have with us the Honorable Colin Riley, Minister for Health and Education, Dr. Kasim, the senior medical officer, surgeon at the Glendon Hospital, and Sister Gray, Ms. Nurse Gray, staff nurse working in operating theater. Today is a very historic day for us at Glendon Hospital and the Ministry of Health. We want to share this historic occasion with the population to let them know what is happening at Glendon, and also so that they will have an appreciation with the commitment of the Ministry of Health and government in providing better services to the people of Montserrat. As you know, the government on the redevelopment agenda of the Glendon Hospital, and we are very excited about it. And there are some people who feel that things are not happening, but things are happening, and we thought it is best to let the public hear and know about this special occasion today. Let me first of all invite Dr. Kasim to give some brief remarks with regards to the major piece of critical equipment which have arrived on country, and it's how he feels as a surgeon providing surgical services to Montserrat. Then we will ask Nurse Gray, to a senior nurse in operating theater, to make some remarks, and the Honorable Minister will then give the closing remarks on the behalf of the government. So thank you, Dr. Kasim.
Good morning, and thanks for inviting me to be part of this handover, or whatever we call it, ceremony, just to the introduction of the equipment. We're really happy, and especially Dr. Kasim, who is the general surgeon, is very happy with the equipment that have arrived on island. We have endoscopies. We asked for 2, and we have 6. So that is really fantastic, because then we have replacement, and then we could do multiple procedures at the same time. Let me just give a little explanation as to what endoscopy is. Endoscopy is what we use. It's a camera, it's equipment with camera. In this case, it's a video scope, so it's actually a video camera, which is used to diagnose diseases in the stomach and in the intestine. You might get people going to Antigua doing colonoscopies. We have the equipment right here on island now. We need to put a little bit of training into those who are going to use it to be able to have colonoscopies on island. So as I said, we asked for 2 and we have 6. So we are really set in that direction. The next piece of equipment we have is the operation theater light. It's been in the pipeline for a very long time. About a month or so ago, it was received on island. It needs to be installed. There's communication going on between the provider and our Public Works Department in terms of the technicalities to be able to do the installation. Again, I will say this piece of equipment, which is the operation theater light, is critical for doing surgeries, and being a surgeon, to be able to do proper surgery, you definitely need to get good visibility, meaning you have to see what you're doing, because you can't see if you're doing surgery. You can't cut, if you can't see. So in other words, that is a fantastic equipment that has arrived on island. And then we have a third piece of equipment, which is the incubator. Incubator is a piece of equipment which is used to warm babies who sometimes come out early, meaning they are delivered before time, and they need an environment that is almost the same as the mother's womb And that is an equipment that is really good, because then what we're doing is it helps us try to increase the survivability, or what we call it, the live babies when delivered on island, preventing deaths. So again, it's a very good piece of equipment. It's not that we didn't have any. We did have, but then we wanted an additional one to make it 2, because sometimes when you have 2 deliveries that are actually come out before time, it's difficult to manage with the one we had. So this is an equipment that is going to help us in that in that field. Now, just a little bit of background concerning these equipments. These equipments have been on a list for some time now, and as part of the equipment committee, we struggled to actually get them. When the list was actually compiled initially, it was very difficult to source funds, because the government of Montserrat didn't have funds for capital projects which these equipments fall under. So then we were so happy when the project started, which is the hospital redevelopment project started, and in discussion with DFID, DFID agreed that some of the mobile equipment, such as those we just purchased, or those that have been purchased that we have now, could be front-loaded before the hospital is actually constructed and completed. So that is the little history, and that is the reason why we got them. So it's actually, this equipment we're getting now is actually part of the new hospital redevelopment project, which have been front-loaded to be able to give us the opportunity to start using them before the hospital project is finished. So we are really, really happy for having these equipments, and I think this is going to serve us and increase the quality of services we provide to the people of Montserrat and whoever decides they want to live on island. So I think we thank those who made it possible to get them, and we're looking forward in the future to having the rest of the equipment that are on the list that we are still waiting to receive. Thank you very much.
Thank you, Dr. Kasim. I now ask Nurse Gray to give some brief remarks on behalf of nurses at Glendon.
Morning, listeners. I would like to say it's a joy and a pleasure for us to get these equipments. As Dr. Kasim said, in order to do surgeries, you need to have light, so you have good visibility. That would make the nurses as well as the doctors' life much easier in the operating theater. Also, with the scopes, it would help to improve care on island, because that would allow persons now who cannot fund going to Antigua to stay on island and get their procedures done. And the incubator, I must say that I am happy, and I'm sure all the other midwives would be happy to have that extra equipment. It would make our life and our job much easier. And so on behalf of myself and the other nurses, I would like to say thank you to the ministry and to all who had a hand in us getting these equipments.
Thank you, that's great. And I'll ask the Honorable Colin Riley, who is the driving force behind the Ministry of Health and Social Services, to make some brief remarks.
Good morning, everyone, and welcome to this very important day in the redevelopment and reestablishment of our health services. As you know, we have great people working at the Glendon Hospital, and when I came in just about 5 years ago now, I thought that they needed to get a number of things to happen. One was to rebuild the place, and that is about to begin. Major project, about $30 million worth of construction. We have about $5 million worth of equipment that we're ordering. But I think Dr. Kasim hit a lot of very good points in his presentation, and one of them I want to emphasize has to do with the training of our people. because without good staff, we are not going to be able to deliver the service that the people of Montserrat richly deserve. So I know the doctors are very committed to their work, and they are part of a wider professional society that represents medics all over the world. And, you know, we connect to systems abroad through Mount Sinai, Dr. Isilma Fergus-Rowe, who comes in here once a year, and Dr. Joe Daly and his team at the University of Toronto Hospital. Also, Dr. Spencer Perkins out of Trinidad, who comes in here as well, and some of the other visiting professionals from Dominica, Antigua, and elsewhere. So we have a broad-based medical professional core that delivers services here at the Glendon Hospital. We also have some excellent nurses who we know from time to time go abroad for training and have on-island training as well. We have 5 persons within the last 12 months who have gone off for training. And when I look at the number of persons who go to PAHO and other specific training run by CAFA and other regional organizations to include MCAP, I know that Montserrat is part of this responsiveness to the disease profiles that are beginning to emerge in the Caribbean and in countries of this size. So the pieces of equipment we see, the hospital theater light is the one that I am most excited about, because I know this project took some time to get completed, but now it's almost done. The lights are here, and I know Dr. Kasim is going to be able to see his patients a lot better. And by the way, I am one of his patients, and I want to say thank you very much to Dr. Kasim for doing an excellent piece of surgery on the minister, and he advised me to stay in the hospital for a little while to recover. I stayed about 6 hours before I got a little tired of being here and wanted to go back to my private space. But I had a great experience with the medics, the staff of nurses who supported his work, and I felt so comfortable. 5 times I've been to the hospital for procedures since I became the minister, and every time I say, look, I've been to hospitals in Boston and I've been to hospitals in Montserrat, and I see no difference. The quality of the care is just as good here at that level. Sometimes, you know, when you go to the specialist levels, you need better equipment, you have to go off island. But for what we offer, we're matching every single other hospital in the world, I believe. So I have that confidence in our staff. The people who work here are committed to the healthcare industry. And I don't want anyone to think that I don't care about the staff. I tend to come for what I call a moderate visit schedule, because I believe that this is a place for the practice of medicine, and that I want to encourage the medics to run the place, the doctors and their leader, the nurses and their leader, the people who are involved in medical diagnostics and their leader. And the minister comes in to support them and give them that boost so that they can do even better service. Now, when we speak of hospital redevelopment, I want people to think beyond the building. Think beyond the 3 floors and the elevators that some people talk about already. And I'm happy that is happening as well. But I want us to think about the quality of care that is going to be associated, the improvement in the quality of care that is going to be possible when we get a new building. We are going to be excited, I believe, to come here. A little bit more excited to come to work, I believe. We're also going to have better equipment. And we want a complete list of equipment for the things that we want, we believe we can do. We are confident we can deliver once we have the equipment. Budgets are annual instruments of finance. And every year we get a chance to budget again. There's capital and there's recurrent. The hospital is high priority and will remain so, which means that we can grow the equipment list at the hospital. So we want people to calm down their fears about equipment. The procurement processes are getting better and a little bit less time constrained because we have money now. So as the equipment starts to come in, and today we see 3 pieces, some of it can be procured through donations as well, some through the government procurement systems. And we are quite happy that we have been able to solve 3 problems in one day. So like they will say, kill 2 birds with 1 stone. We are solving 3 problems in one day. And that required some degree of thoughtfulness. And good leadership is associated with thinking and acting. You think collectively as a team. You act collectively as a team. We leave no one out. All the ideas contend, and we continue to deliver health care for the people of Montserrat. We get better every day. We believe in the professional standards and the professional ethic. And that is what we emphasize. Partnership, teamwork, building a system that has enduring value and high qualities. That is what I stand for. So I'm happy that we're able to receive these. Mr. Gilchrist, I know you did a great job. So to Nurse Gray and your team, I know you have a lot of nurses there. 50 of you are here. And we want to put some more here. Dr. Kasim, you have 7 in your core, and maybe about 20 who join you periodically. So to your team as well, thank you for the hard work. And the hospital is coming for real. Thank you.
Thank you, Minister. I just want to make the Minister feel comfortable here and the nation comfortable. One of the issues concerning equipment is maintenance. And let me assure the nation that the Permanent Secretary and Chief Medical Officer have indicated that the training of a biomedical engineer is a critical staff for the sustainability of the hospital new system and also of the equipment. We very soon, some Montreal National will be going off to study biomedical engineering, and that person, once returned, will be responsible to ensuring the maintenance of all of our equipment. So we are a thinking ministry under the leadership of the Minister and the Permanent Secretary in ensuring that the monies are well spent. As we say in health, the new Glendon Hospital caring for a brighter future. Thank you, and you may now take a picture.
Movement for Change and Prosperity.